If your child's feeding tube is clogged, you should use a clog zapper to unclog the feeding tube. Before using the clog zapper, make sure feedings are disconnected. Inside the clog zapper kit, there is a clog zapper syringe, a water syringe, gauze pads, an applicator, and instructions from the manufacturer. If your child has a PEG-J tube, you will use the applicator. If your child has a feeding tube other than a PEG-J tube, do not use the applicator. To use the clog zapper, first wash your hands. Then, if your child has a PEG-J tube, you will need to insert the applicator. To do this, remove the cap from the straight port of the J tube and insert the applicator into the straight port. Continue inserting until the hub of the applicator reaches the edge of the feeding tube or until you meet resistance. To use the clog zapper with all feeding tubes, remove the cover from the clog zapper syringe. Take water in a clean container and fill the clog zapper syringe to the 10 milliliter mark. Place the cover back on the clog zapper syringe and shake the syringe until you remove all lumps. Remove the cover on the clog zapper syringe. If you are using the applicator, insert the clog zapper syringe into the applicator hub. If you are not using the applicator, insert the clog zapper syringe into the feeding tube or extension. Slowly push 2 to 5 milliliters of the clog zapper mixture into the feeding tube, using the gauze to catch any spills. If you are using the applicator, remove the applicator from the feeding tube. Then, remove the clog zapper syringe from the applicator and close the cap on the feeding tube. If you are not using the applicator, remove the clog zapper syringe from the feeding tube. Replace the cover on the clog zapper syringe. Place the clog zapper syringe in a sealed plastic bag. Place it in the refrigerator so it can be used for the next 24 hours if needed. Let the clog zapper mixture sit in the feeding tube for 1 hour. Do not put food, water, or medicine into the feeding tube during this time. Once the time has passed, fill the syringe with water from your clean container to the 6 milliliter mark. Open the cap on the feeding tube or feeding tube extension and attach the water syringe. Slowly push 6 milliliters of water into the feeding tube. If the water flows easily, the feeding tube is ready for use. If the water does not flow easily, you will need to give the clog zapper again. Do not use the clog zapper a third time to remove the clog. Instead, call your child's doctor. Put the clog zapper syringe into the garbage 24 hours after you first add water to it.